Assalamu alaikum. My name is Sadine Saraire. Primary application for polymer gel dosimeter. Polymer gel dosimeters are commonly used in radiation therapy to measure and verify the dose of radiation delivered to a patient. They provide accurate and detailed information about the dose distribution within the patient's body. Gel dosimeters have several outstanding features that no other radiation dosimetry tool could offer. They are nearly tissue equivalent, can be used as a 3D dosimetry phantom, and have the ability to capture 3D dose distribution in the irradiated volume and allows to perform measurements of dose induced by different types of radiation: photons, electrons, protons, neutrons, gamma, and X-rays in a broad range of energies up to hundreds of million electron volt and those up to tens of gray, accurately and with good spatial resolution. These pictures show a three-dimensional radiation dosimetry using polymer. Radiation-induced structural changes in dosimetric gels are associated with changes in the chemical and physical characteristics of the gels, which can be measured using different imaging techniques: magnetic resonance imaging, MRI, X-ray, and optical computed tomography, CT, optical scanning, vibrational spectroscopy, sonography, and other techniques. The applications of gel dosimeters include basic dosimetry such as deep dose, penumbra, and wedge profiles in different types of beams, dose distribution from various imaging procedures, dose distribution from different radiotherapy techniques such as conformal therapy, intensity modulated radiotherapy IMRT, and stereotactic radiosurgery, dose distribution around various brachytherapy sources. Treatment planning verification. Dosimeters assist in verifying treatment plans designed by medical physicists and radiation oncologists. Quality assurance in radiation therapy, ensuring the accuracy of radiation doses delivered during treatment is critical. Polymer gel dosimeters help in verifying the actual dose received by the patient. To verify the dose distribution resulting from modern radiotherapy techniques, as a dosimeter is needed to accurately measure 3D dose distribution with high spatial resolution. Primary application for polymer gel dosimeter: 1. Tissue heterogeneity. 2. 3D CRT, three-dimensional conformal radiotherapy. 3. IMRT, intensity modulated radiation therapy. 4. PNCT, boron neutron capture therapy. 5. Brachytherapy. 6. Proton therapy. Thank you.
Assalamualaikum and hi, my name is Umar Haris Hakimi bin Harun. I am from Group 4, so today I will present about advantages and disadvantages of polymer gel dosimeter. For the first part, let's look about advantages of polymer gel dosimeter. In radiotherapy, the use of gel dosimeters can help in high-resolution and precise verification of 3D dose distribution obtained by treatment planning facilities. Second one, polymer gel dosimeter are constructed from chemical materials that are sensitive to radiation and are polymerized as a function of the absorbed dose on irradiation. Next, according to Senden in 2006, the magnetic resonance imaging can read the structural change in different polymer gel dosimeter properties, such as variation in the proton nuclear magnetic resonance realization time, mass density, opacity, and elasticity. Next, gel dosimeter also are relatively safe to fabricate and handle. And last one, high thermal stability and transparency. Okay, look at the right side of my slide. The first picture show how we use the polymer gel dosimeter during a 3D method. So irradiated polymer gel can be measured with different techniques, and magnetic resonance imaging is the most common one. So the main goal is to calculate radiation dose distribution in 3 dimensions. And the second picture is two picture that we want to compare the condition of polymer gel dosimeter before irradiation and after irradiation. So these two pictures show how much polymer gel dosimeter have a sensitivity to radiation. So after irradiation, the structural, the color will change when it's been irradiated with a 2 grade of dose. Okay, and we move to next slide. So second part, we want to talk about disadvantages. So one of the disadvantages is first one is this polymer gel dosimeter is only limited to clinical application, and the second one, it also hard to determine which combination and type of polymer gel are the best, since each gel dosimeter had advantages and its limitation. For example, methacrylic acid based gel dosimeter are high dose sensitivity and low toxicity, while their dose response is beam energy dependent. In contrast, an isopropyl gel dosimeter have a low dose resolution, but their sensitivity is lower and they are relatively toxic. Next one, according to Waldenberg in 2017, the problem of this polymer gel dosimeter is its toxicity of monomers. And the last one is polymer gel dosimeter also is difficult to manufacture. Okay, so we look at the picture. So this picture is during one of the method that we use in a radiotherapy, where this method called a patient QA. So in patient QA, we will use polymer gel dosimeter to detect the dose that exposed from Linac machine. And then for the last part, why we prefer the gel dosimeter rather than other dosimeter. This gel dosimeter, with the capacity to uniquely record the radiation dose distribution in 3 dimensions, have specific advantage when compared to 1 dimension dosimeter such as ion chamber and 2D dosimeter such as film. In radiotherapy, polymer gel dosimeter can give good result for equivalence between the measured dose and the absorbed dose in patient's tissue. And the last one, good thermal or temperature stability temperature during irradiation and scanning. So this one is one of article by Dini in 2004. For the first point is one of the result based on article by Schreiner in 2010. Last but not least, this is a list of our reference. I think that's all from us. Thank you. So I would like to thank you for your time and attention today. Thank you so much for your interest and attention. Thank you for our lecturer, Dr. Nurul Zahira. And also like to thank to our group mates for their cooperation and hard work during our assignment time. So that's all from us. Thank you. Assalamualaikum warahmatullahi wabarakatuh.